If I had to pick one thing that a specialist could do right now that would have the most direct impact on how many referred patients actually call and schedule, it would be reviews, specifically Google reviews. What really kind of like is important about the reviews is what's actually written in the reviews. That's what's most important. What patients are reading in your reviews, as well as what the AI search engines are reading in the reviews, is the services and the language that help to influence the AI search engines and whether a patient's actually going to come to your practice. It's about the specifics. What did the patient experience actually feel like? What procedure did this patient actually have? Did the team communicate well with the patient? How did the doctor handle their anxiety or their questions? For a specialist, that specificity matters even more than it does for a general dentist, because the patient reading your reviews is often about to commit to something that feels significant. A review that has 5 stars and says great office does not give the patient reading that review really much context. But if the review says, I was terrified to come in for this procedure, I needed to do a full mouth reconstruction, but the team explained every step, they gave me sedation, and I'm feeling so much better now about my smile and about my life. That type of review converts nervous patients. That's the review that gets a hesitant patient to pick up the phone. So how do you get those reviews? Well, you simply have to ask for them. If your team has a little bit of training and there's a small incentive in place to encourage them to ask, it can become an easy, natural part of the internal workings of your practice. There are softwares that can help speed things up and automate the process. Volume matters, recency matters, specificity matters. And for specialists, the emotional language that tells a nervous patient that it's going to be okay matters more than anything.